With tens of millions of Americans facing crushing medical debt, Consumers for Quality Care wants you to be in the know. That's why for Health Literacy Month, we're sharing tips that you can use to reduce out-of-pocket healthcare costs that can lead to medical debt. Choosing the right insurance can help Americans avoid the high out-of-pocket costs that can lead to medical debt. More than 1/3 of voters have delayed necessary care because they couldn't afford the out-of-pocket costs. Policies with high deductibles, the amount you're responsible for before your insurance begins covering treatments. Copays, the amount your insurance requires you to pay for treatment. And coinsurance, the percentage of costs of a covered service you pay even after you've met your deductible, are the out-of-pocket healthcare costs that concern Americans the most. Even worse than high-deductible health insurance plans that carry high copays and coinsurance costs are short-term, limited-duration insurance plans. These policies are insurance in name only. They often block coverage for pre-existing conditions and limit coverage for the few services that aren't blocked. They're also not required to cover preventive services at all. For every $1 you pay in premiums, these plans often spend less than 10 cents on your health care, which is why many patients are often left with high out-of-pocket costs and crippling medical debt. In addition, many Americans who rely on prescription medications fall prey to insurance company copay accumulators. Copay accumulators shift costs from the insurance companies to patients. They let insurers block any financial assistance you receive, like a voucher or a coupon, from counting toward your deductible. So when that assistance runs out, you have to pay your deductible again for a second time with money from your own pocket. This double dipping by insurance companies hurts patients with chronic diseases the most, like those with hemophilia, HIV/AIDS, and some types of cancer. When shopping for insurance, make sure to watch out for plans with high deductibles, high copays and coinsurance, and copay accumulators. Don't be fooled by lower-cost STLDI plans. While these plans often have lower premiums, they can leave you with big medical bills that you aren't prepared to pay. If you have a problem with your coverage, contact your state insurance commissioner. With medical debt becoming an increasingly pervasive problem, it's essential that Americans reach out to elected officials and ask them to address the root causes of medical debt. Tell your lawmakers to strengthen the No Surprises Act and ensure that the law is being fully enforced. Urge them to create strong and enforceable standards for charity care, to support health insurance reforms that prohibit insurers from double-dipping at the expense of patients, eliminate insurance schemes like STLDI plans, and cap deductibles and other out-of-pocket costs so that people can get care without going into debt. At Consumers for Quality Care, we are dedicated to helping consumers like you understand your options when it comes to medical debt. Visit consumersforqualitycare.org/health-literacy to find more resources on how to prevent and help mitigate the impacts of medical debt.